Here we're going to see the suture materials. First, to start off with questions. Question 1 is, what is the polygalactin suture material? Next question is, what is the polyglycaprone suture material? Third is, what is the nylon suture material? So what we need to know is the types along with the uses. So in this video, we will have the answers to all these questions, and there are some bonus questions in the end of the video. So firstly, we look at catgut. So the catgut, it comes under the absorbable. It is nothing but absorbable suture material. And this is what type of it? The type is, it is plain as well as it is chromic. So what is the use of the catgut? If we look at the use, it is used to ligate. It is used to ligate the superficial vessels, and then what it does is it sutures the subcutaneous tissue as well as the stomas and other tissues, and the tissues which heal rapidly. Next we move on to the poly, that is a polygalactin. So polygalactin is the vicryl, and it is also the absorbable suture material, and looking at the type, it is braided. It is braided as well as it is multi-filament. So what are the uses of the polygalactin or the vicryl? So the uses is nothing but, it includes, there is the gut and the biliary anastomosis. Then there is also the vascular ligatures. Then it is also used, the polygalactin vicryl is used in case of the kidney. It is used in case of the kidney and the ureter surgeries. Then it is also used in case of the subcuticular wound. Then we move on to the polydiaxanon. So the polydiaxanon, it also comes under the absorbable suture material, and looking at the type, it is a monofilament. Next, it is nothing but it is dyed as well as the undyed. So what are the uses? So uses is the polydiaxon. It is used in case of the tissues as well as where there is longer wound support. Where there is use of longer wound support is required. Then we look at the last one, that is the polyglycaprone. So the polyglycaprone also is nothing but it is an absorbable suture material. So here we look at the polyglycaprone is also known as the monofilament. Cryl. And looking at the filament type is monofilament. And then looking at the uses of the polyglycoprone. So what are the uses? The polyglycoprone is a monofilament which is used in case of the the subcuticular, subcuticular suturing of the skin. Next, it is also used in case of the soft tissue ligation. Next, it is also used in case of the gastrointestinal as well as the muscle surgery. So next, we'll be looking at, so whatever we saw till now, it comes under the absorbable suture material. So now we'll be moving ahead with the non-absorbable suture material. So now we're looking at the non-absorbable suture material. So under this, firstly we'll look at the silk. So what is silk? So silk, it is non-absorbable as we first discussed, and it is braided. It is braided as well as it is twisted multifilament. It is braided as well as twisted multifilament, and the silk is coated. It is coated, so it can be coated with wax as well as the silicone, and it can also be uncoated. So what is the use of this silk? So the use is that it can be used for the ligation as well as the suture. So it is used in ligation as well as suture when long-term tissue support, for the long-term long tissue support. Then it is also used for the securing. So you can secure the drains. It is used for securing drains, and this is done externally. And there is also the two layer bowel anastomosis. So then we look at the next one, that is the steel. So steel again, it is non-absorbable, and the type is, it is monofilament as well as it is the multifilament. And what is the use? The use is that it is used for the closure of the sternotomy wounds. It is used to close the sternotomy wounds. Next, we move on to the nylon. What is nylon? So nylon is, again, it is non-absorbable. It is nothing but a monofilament. It is a monofilament as well as a braided multifilament. And where is the nylon used? The use of the nylon is, it is used in case of the skin closure as well as in case of the abdominal wall, closing the abdominal wall, that is abdominal wall closure. It is used in case of the hernia repair, as well as in case of the neurosurgery, the nylon can be used. So after this, we will look at the polybuster. So what is the polybuster? So it is, again, it is a non-absorbable suture material, and it is a mono. It is monofilament. So what is the use of this poly beta ester? The use is it exhibits the elasticity. It exhibits the elasticity, and the poly beta ester is used most commonly in the plastic surgery. So because of its elasticity property. So then we look at the polypropylene. So what is a polypropylene? It is the proline. So here it is again, it is a non-absorbable suture material, and it is nothing but a monofilament. Next is, what is the use of this polypropylene? So the use is, it is used in case of the cardiovascular surgery as well as the vascular anastomosis. The polypropylene is also used in case of the plastic surgery, and it is used in case of the general surgical subcuticular skin closure. So now we will go back to answering our questions. So the first question we asked was, so we're going to look at the answers. So the first answer is, what is polygalactin? Polygalactin. So the polygalactin, it is a absorbable suture material. It is absorbable suture material. Polygalactin is commonly the vicryl, and it is a braided. It is braided multifilament. And what is the use of this polygalactin? The use is that it is used in case of the gut as well as the biliary anastomosis. Then it is also used in case of the vascular ligatures. Next, it is used in case of the kidney. It is used in case of kidney and the ureter surgeries, as well as it is used in the subcuticular wound. Now we jump on to the next question. The next question we asked was, question 2. We asked was, what is the polyglycapron? So what is the polyglycapron? So this is nothing but it is the monocryl, and it is also a absorbable suture material. This is nothing but it is a monofilament, and the polyglycapron is used in case of the subcuticular suturing of the skin. Next, it is also used in case of the soft tissue ligation, as well as it is used in case of the GI, that is the gastrointestinal, as well as the muscle surgery. So the third question we asked was, what is the nylon use? So first thing, the nylon, we know it is obviously it is non-absorbable. So what is the type? The type is, the nylon is, it is a monofilament, as well as it is a braided multifilament. And what is the use of this? So the use of the nylon. So the use of the nylon, it is used in case of the skin closure. It is used in case of the abdominal wall. closure. And the other uses, the nylon can also be used in case of the repair of hernia. That is, in case of the hernia repair. Next, it can also be used, nylon. It is used in terms of the neurosurgery as well. So next, we are going to ask some bonus questions which can be answered in the comments. So the first question is, where is the polybutester used? So we want to know the type of filament, type of the suture as well as the uses. So the question 2, where is the surgical steel used? The third question, this is very important, the catgut. What type of suture material it is and what type of filament it is, whether monofilament, multifilament, as well as the use of all these suture materials.